Hey everyone, welcome to The Dish. I'm your host, Anna Christina. Thank you so much for tuning in. We're kicking things off with awareness with Anna, and I'm going to be honest with you. Now, this topic is one that is often whispered about, but today we're talking loud about it because there's often people that are both intrigued and concerned, so we're answering a bunch of questions from Dr. Troy Austin and Melissa Sumner of Southeastern Aesthetic Surgery. Guys, thank you so much for being here.
Thank you for having us.
Yeah, so let's talk about this topic because it is one that is taboo, often forbidden. It's called rejuvenation, or V-rejuvenation, I should say. Tell me about what that is.
So what we're talking about is vaginal rejuvenation. And so we're addressing women's intimate concerns about that area.
Right. And that's a private area. And obviously, besides the obvious, why do women especially have a difficult time, you think, talking about it?
I think it's difficult for people to come forward about problems they might be having with sexual health.
Right. Well, and I think so too, and I think that's one thing to point out is the fact that it's not just about cosmetic, looking different, but about health issues that women often face that we don't talk about. Can we go over some of those? Because some women might be dealing with them and they don't even know. What are some of those issues?
Definitely. Menopausal symptoms such as dryness, pain with intercourse, stress urinary incontinence, having a little bit of urination with sneezing or exercise, some vaginal laxity from vaginal deliveries. All of those things could be helped by vaginal rejuvenation procedures.
Right, and some of those that you just mentioned at the beginning, the intercourse and feeling uncomfortable, some women might think, well, this is what I've been dealt, this is it. And so they do have options when it comes to helping in that case. Now, some of the procedures that you guys do, FemTouch, I know there's an O injection. Can you tell me a little bit about those procedures?
Absolutely. So when it comes to devices for working in this area, we're talking about non-surgical vaginal rejuvenation primarily today. So
which is also good to know, right?
Yes, yes. So from the FemTouch perspective, it's a CO2 laser resurfacing. Okay, it works both inside the vagina to basically remodel the vaginal lining, improve moisture, improve tightness, and also as well as the external aspect for lightening and tightening both the labia minora, labia majora, and basically improving the overall appearance. So far the inside is concerned, since we are improving the mucosal lining, we are addressing those issues that we talked about, especially after childbirth, with stress urinary incontinence, vaginal atrophy. So these are things that are addressed from a non-surgical standpoint.
Which that is great because when you hear, obviously your name, surgery, people think, oh my gosh, they're gonna go down there, they're gonna make, but it's non-surgical. So what is it like after the fact? How long is the recovery? What does that look like?
It's a very quick and painless procedure. The FemTouch can be done in about 15 minutes. It's painless. There's very minimal to no recovery time, and you start seeing results very quickly after having the procedure. Yeah.
That is very, very good to know. I mean, I'm sure, again, it's very difficult for women to bring this up on their own. I love that it's a duo, so a man and a woman is there to kind of help, you feel comfortable about the situation. You guys obviously know exactly what you're doing, but you're also going to be providing an educational class for people if you're out there and you want to learn more and you don't feel like calling, like, hey, what were you guys talking about and where? You guys are actually having a class that they can attend, right? It's June 28th, I believe.
Correct. June 28th from 3 o'clock to 5 o'clock in my office. We are located on North Bel Air Road. Just give us a call. We'll get you a spot.
There you go. And so tell me about what other, what can women expect after this? Obviously, their quality of life is going to be improving.
Definitely. Well, I'm a provider of the procedure, but I'm also a patient. I've had the FemTouch myself, and I'm a mother. I've had 3 children, and I've experienced an increased quality of life with the FemTouch. I've had some of the symptoms that we talked about, some of the symptoms of the post-delivery symptoms, and some of the stress urinary symptoms, and I've had a resolution of my symptoms after having the procedure.
That is absolutely amazing to hear, and I know a lot of women out there are experiencing these things, and so if you have any questions or concerns or you're intrigued, be sure to visit their website. It's seaplasticsurgery.com. Guys, thank you guys so much for being here. really appreciate it.
Thank you for having us.
All right, guys, don't go anywhere. When we come back, we're continuing Awareness with Anna because what we put in our body is super important. I'll tell you why.